Welcome to this learning opportunity on motivational interviewing. My name is Pete Fifield, and I'll be sharing with you some motivational interviewing techniques that you can apply during your conversations with patients regarding their tobacco use. This learning opportunity will address the topic of motivating your patients to quit tobacco. This video is one in a series of other videos available to you to increase your knowledge, skills, and confidence working with patients who use any form of tobacco. The time you spend watching this video will help you work more effectively with your patients. During the next 30 minutes, you will learn some practical tips to talk with your patients about their tobacco use. You will receive 1/2 of a continuing education credit from the North Country Health Consortium, Northern New Hampshire AHAC, after you complete the assessment and evaluation of this lesson. Instructions to apply for the credit are provided at the end of the video. After this learning opportunity, you'll be able to 1. Describe the spirit of motivational interviewing and why it's an effective approach in working with patients. 2. Describe OARS as an approach to elicit change talk in your patients. And 3. Understand how motivational interviewing can be applied in a clinical setting. Over the years, the overall smoking rate for adults has declined. According to recent data in New Hampshire, 18% of all adults smoke. Those who continue to smoke are likely those who can least afford it financially and are probably more highly addicted. A person is more likely to smoke if they do not finish high school and work for low wages. We know these individuals need more intensive support from qualified providers. The standard treatment does not work. To be successful, they need more intensive support and medications. Does this sound like any of your patients? In terms of what will help your patients directly, motivational interviewing is an approach with patients to help motivational change. Most of us want to make some type of change or improvement to our lives, and we argue with ourselves about the costs and benefits of making this change. You can help your patients tap into these internal arguments and make the desired change. What we cover in this session is not an MI workshop. Instead, we'll cover the spirit of MI and how to approach patients where they are in terms of the stages of change and help them to explore both sides of using tobacco. So what is motivational interviewing? In a nutshell, motivational interviewing is a person-centered, evidence-based practice, a style of guided communication that elicits and strengthens intrinsic motivation for change. In other words, a motivational conversation in which the healthcare provider understands. In other words, a motivational conversation in which the healthcare provider understands the level of importance to a patient, their readiness to change, and specific needs and life circumstances regarding that change. By listening and acknowledging the patient's ideas and feelings, you're allowing them the space to make a decision instead of telling them what to do. This type of conversation reinforces their autonomy and ability to change and makes it more likely that they will. The techniques used in MI help to educate and increase your patient's awareness of health consequence. It will motivate your patients towards changing and will assist them with making choices about quitting. Have you ever had mixed feelings about something, be it your health related or not? This is called ambivalence, and ambivalence is absolutely normal. Think about something you've wanted to change in your life. Let's use flossing your teeth, for example. Why do you not floss more often? Is it that you lack education about the risk? Do you need more floss? Do you need more time to floss? Most often, these answers are not the barriers between why a person flosses or not. It's simply motivation to make it a priority to do so. Motivational interviewing can help you and your patients think through their ambivalence about quitting smoking. Arguments for and against change already reside within the ambivalent person. Our job is to help that person understand this. In motivational interviewing language, these two sides of the conversation are called change talk and sustain talk. When you listen carefully, you can hear your patient's ambivalence in the way they talk about their experiences and decisions. Try to appreciate these reasons for both changing the behavior and not changing it, all at the same time. Both of them are reasonable. Arguing with an ambivalent patient or trying to make them see your side is just begging for them to give you a defensive reason for not changing. Don't take the bait, because that will elicit sustain talk, these reasons why I should stay the same. If you react to a statement like, I don't want to change, which is red light talk, by arguing, shouting it down, or lecturing by saying something like, what do you mean you don't want to stop? You have COPD. You're probably going to get defensive, sustain talk responses, or even discord between you and the patient, which is yelling back, or better yet, door slamming. And you may miss hearing the other more subtle examples of your patient's desire to change, like, I want to be able to walk my daughter down the aisle. Not getting into an argument gives your patient room to reflect on their own reasons to change. Instead of struggling with ambivalence, you can gently guide them through their behavior change process. In situations like this, you can choose to respond with communication and behavioral strategies that help tip the scale towards change. Patience can come in very handy here. First, let us establish that ambivalence is a normal part of the human condition. We often hold two competing or opposite points of view. We often describe this as our head wanting one thing while our heart wants another. We tend to judge the natural human condition when it is a topic that we seem as a very clear next step or one that we've never experienced ourselves. Ambivalence can look like resistance. The person is anxious, unsure about making a change. It's easy to think the person is resistant to that change, but in fact, they might just be afraid to the change or afraid of making all the changes at once. They might be willing to make an incremental change towards the bigger goal. MI helps the person think through both sides of the change, what they want to face and what they don't want to face, and change on their own. By listening carefully, you'll understand what your patient is really saying. Listening to and understanding your patient is the core of a brief intervention. Our objective at this point is to identify and influence any ambivalence the patient might have at that point about problematic substance use, in this case, tobacco. The key here is helping your patients move toward the side of ambivalence that they want to change. In this case, amplifying the change talk. This only happens when your patients perceive that you're non-judgmental, you're an ally to them, and supporting them in making this change. One way to help a patient through this ambivalence is by using an MI skill called OARS. OARS stands for open-ended questions, affirmations, reflections, and summaries. This can take anywhere from 5 to 15 minutes in total of time with the patient. The first one to remember is O, for open-ended questions. Here are some examples of an open-ended question. Tell me a little bit about your relationship with cigarettes. What motivates you to try quitting? What experience do you have with quitting? What do you think would be the hardest part of quitting? Or tell me a little bit about how life might be different if you managed to quit smoking. Open-ended questions elicit a narrative from the patient that will hopefully move the conversation forward. If this doesn't work, don't worry. Listening carefully and noticing the sustained talk and the change talk are both important. You can always end the conversation by stating something like, I hear you're not really ready to quit right now. Keep thinking about it. It's most likely the best thing you can do for your health and your family, and we'll talk about it next time. And then you move on to the rest of the appointment. After the O is A for affirmations. With affirmations, you're recognizing what your patient is telling you about their strengths and values. This allows your patient to build confidence in their ability to change. You need to be genuine, though, and very specific when you give an affirmation. Something like, sounds like you've made a wonderful progress in cutting back on your cigarette intake. That's really awesome that you delayed that first cigarette for over an hour. You're on the right track. Or, you're really trying hard to cut back. A simple statement like that can acknowledge their efforts so far. You could also use something like, nice work using a patch during the day while you're at work. Next we have R for reflections. Reflections can take on 3 different levels. Basic repeating of the patient's statement, paraphrasing the patient's statement, or reflecting the underlying feeling of what the patient is saying. You could start by asking, so what do you like about smoking? Reflect their feelings in order to demonstrate understanding. For example, you could say, you really have a close relationship with tobacco. What else is good? You want to push the limits of the conversation. Here, you want to pay attention to, are there any downsides to smoking? When you hear the ambivalence that they say, reflect it using a double-sided reflection. You can use this formula. On one hand, you, and on the other hand, you. You want to reflect both sides of the statement to highlight the patient's ambivalence. Do your best to end with the healthiest behavior. For example, on one hand, you could smoke forever, but on the other hand, you really want to quit. S for summaries. The last thing you want to do is wrap up the conversation, is to summarize the discussion to make sure you and the patient are on the same page. You're able to choose what to include and emphasize during the summary. Make sure to reflect concerns about the change, problem recognition, optimism about the change, and ambivalence about the change. Let the patient know you're listening. Be concise and ask the patient to respond to your summary. It is okay to use collateral information as well. You could start your summary with something like, so let me see if I've got all of this straight. And at the end, you end it with, is there anything else you'd like to add? Lastly, before we wrap up, I want to encourage you to learn more about 1-800-QUIT-NOW. You can watch the lesson as part of this series or call or visit their website to learn about their services and how to refer your patients. Their services are a valuable tool in working with patients. They provide several forms of free nicotine replacement therapy and offer intensive coaching to your patients. MI takes practice. I want to thank you for joining me today and for all the hard work you do with the patients addressing their tobacco use. You provide them with valuable, evidence-based information on effective ways to successfully quit smoking. That's not an easy task. Thank you. Hi, Teresa.
Hi there, how are you?
I'm doing well, thank you. My name's Pete Fifield. I'm a behavioral health therapist here, and I was just talking to Dr. James, and she mentioned you might be interested in quitting smoking.
Yes, Dr. James has been riding me hard for a long time about quitting. I think I'm finally ready to take the next step and try to quit.
It's reached this level of importance for you.
Yeah, there's so many places that are cutting out smoking, like my work, I can't smoke at work. I can't even smoke on campus anymore. I have to take my car off campus. It's becoming very inconvenient to smoke.
That's a very important word. It's inconvenient to you. It sounds like it's not really fitting who you want to be either.
Well, that's hard to say.
Okay.
I've smoked for so long that it is who I am.
Sure.
It's the other side of me is just saying it's so inconvenient, it's so expensive, and it's time to let it go.
Cost, inconvenience, it's just timely right now to take a different step. Could you tell me a little bit about a time you had had success in the past quitting?
Oh, a long time ago, when Chantix first came out, I went on Chantix for a little while. I think I was on about 3 months. It was, I actually went on it because I had gotten sick.
Okay.
And the doctor I was seeing said, gave me the medicine for bronchitis.
Sure.
And then sent me home with a prescription for Chantix, which I tried. I was easily able to stop smoking, and then and so that worked for me.
Yeah.
But it wasn't long before my prescription ran out. It's really expensive, so I didn't get any more. And then before long after that, I was back to smoking.
Okay.
Again.
So you had some really, like a month or so, maybe even a little bit more, of successful quitting. Kind of when the medication ran out, old habits kind of fell back into them, right back into smoking again.
Yeah.
Tell me, how did it feel when you weren't smoking?
Kind of bizarre, like something was missing, but it wasn't.
Okay.
Like I wasn't I wasn't the sick craving like I expected, or when I had quit for a day here and there. I had gotten really almost sick with it.
Okay.
But I didn't have that sickness. I just, it was like I was missing something to do with my hands, something to do when my friends went outside. It was just kind of bizarre that way.
Okay, yeah. So on a scale from 0 to 10, 0 meaning you're not motivated at all, and 10 being you're very motivated, where do you lie on that spectrum?
Oh, probably high 7.
Really? It's that important?
It's getting that way,
okay.
yeah.
Okay. Tell me a little bit about why not a 6.5? Why not a 6?
It's the cost and inconvenience.
Okay.
It's just, I'm at a point where I'm done spending that much money. I've got other things I want to do with it. I'm just done spending that much money, and I can't leave campus. I can't keep driving off every time I want a cigarette.
Once again, and these are very consistent themes: cost and convenience. They're just not worth it anymore.
No.
So a 7 on a scale from 0 to 10, that's pretty high. How could we get that to 7.5? What would allow you to feel a little bit more confident?
I'm not sure. I need some support somehow to kind of get me over the hump.
Tell me what you know about QuitNow. Have you heard of that?
Oh, well, yeah. I just saw an advertisement on TV for QuitNow, New Hampshire. It was little clay people walking around.
Okay.
What appealed to me about that was the free counseling.
Yep.
And the free nicotine replacement therapy.
Yes.
I don't have great insurance, so the free nicotine replacement therapy would be great. Plus, it's not just one kind. It's patches plus gum or patches plus lozenge. So that would be helpful.
Okay.
And to talk to somebody over the phone and not have to drive somewhere or get sitters for my kids, that would be very helpful. More convenient.
More convenient. Yep, absolutely. So the patches are appealing, or the gum, or the lozenge, or whatever choice you have, and the convenience of the counseling. And they're absolutely outstanding. They're superb. They use motivational interviewing all the time, helping you work towards what you want your goal to be. It's a little bit of a process, not much. Can we talk about what that would look like to refer you to them?
Yeah.
Yeah? Because I simply have to just put you a referral in, and they'll give you a call.
Okay, that would be great.
Would that
I'd
be
really
all right?
appreciate that.
Yeah? Okay, then why don't we check in again in a week? I'm going to put this referral in and see how things are going.
Super, thanks so much.
Absolutely.
Thank you for taking the time to complete this module. To receive a Certificate of Completion, or CEU, for this lesson, you need to complete the 2-part assessment. The links are at the QuitWorks New Hampshire website for you to click through to a survey.